evening, everybody. Thank you for coming to the July 6th Public Health and Safety Committee meeting. I would like to call the meeting to order, and we're going to start with the Pledge of Allegiance. Now, the glory allegiance. Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Okay, Karen, can we go on, please?
Rule.
Here.
Dollinger. Here. Berry. Militello. Here. Rice. Here. Summers. Here. O'Dowd.
Here. Okay. First thing on our agenda, we have approval of the minutes from the Will County Public Health and Safety Committee meeting, June 1st.
So moved.
Moved by Summers, second by Rice. All in favor?
Aye.
Minutes are passed. Next we have miscellaneous reports. And the first report, we have a Sunny Hill Nursing Home updates, and there's some important issues in there. So I would like to have the new executive director of the nursing home, Becky Halverson, come up. I want everyone to be able to meet her today too. You may have seen Becky around when she would come with Karen. But Karen has passed the torch on to Becky. So for those of you that didn't get to meet Becky, there she is. And Becky, do you know everyone on the board here, or shall we go around real fast for you?
I think so. I think I've met everyone.
Okay.
Yeah.
All right, great. So she's got a couple things she just wants to highlight, so I asked her to go ahead and give us the highlights. Thank you, Becky. You want to push your little star.
All right, so that wonderful packet that you get every month is full of a lot of information, and I understand that. A couple of things that we've done lately that is really kind of exciting for us is we're looking at our renovations, of course. We've been talking about renovations till there's not much left to say, quite honestly. We've been talking about it for so long. So the first time in 13 years, we have all 6 of our avenues open. And we're very excited about that, and we've met our goal of 26 residents per avenue. The majority of the residents have a private room, and the people are much happier than they have ever been. So, you know, we want to thank everyone for that opportunity, because this has put us in a different level of long-term care by being able to provide those private rooms. We're doing a little flooring project right now to finish up the some old floors that, you know, we've been working on this for about 14 years. So needless to say, after that long, you need to kind of start all over again somewhere. And we're working forward with that, and it's been wonderful. Everyone's very happy. So we appreciate the opportunity to be able to provide those services to our residents. I just wanted to, a couple of things that we're kind of excited about. It's been in the newspaper lately, and actually one just came out this past weekend, but we have finally met a 5-star rating through CMS, and that's been a lot of work to get there, let me tell you. And it's going to be a lot of work to stay there, because it's a very fragile position. So hopefully we can keep that going, and we're working very hard to do that. So we're excited about that. And then the Illinois Healthcare Association was kind enough to award us with a couple of annual awards, the one being our Community Partnership Award with KSKJ for our Music and Memory program. This is something that we've been working on for a long time, and it's really taken off running in the long-term care industry, where people, we choose personal songs and music for people, especially those with dementia that are having a little bit of behavior problems. It's really good for. And we provide them with iPods and earphones, and they get to listen to their stuff, not our stuff. And that's the tricky part of it. We have to find out exactly what they like, not just the Bee Gees or whoever they are, but the exact song. So it takes some time to do that. So that actually won the Community Partnership Award in Illinois, so we were excited about that. And then the other program, the Innovative Program of the Year, is actually a program that's kind of been my baby since the beginning of time, and that was our resident interview committee, that our residents interview and approve all new hires. We've been doing that now for a little over 9 years, so we've pretty much stuck to this, and our residents have, everyone who's been hired in that length of time have either thumbs up or, well, thumbs up if they got hired, obviously. There have been some thumbs down. And so we won that. That was kind of cool. I even hesitated to even submit for that because I'm very protective of it, and I didn't know if I wanted it to be called a program or not. It was more of a way of life for us, but they were really excited about it and gave us that award. So that's just a couple things that's been happening. We're plugging along and trying to do the best that we can. And we think our residents and families are pretty happy, and it's just a great time at Sunnyvale.
All right, thank you so much, Becky. Thank you for the update, appreciate
Can I
it.
ask you something?
Sure, go ahead.
Or actually, I'm going to ask you to share something, since I do that for a living as well. I want you to explain to them the difference it makes in a person if you could overall change the attitude with the music, because it works quite well, actually.
And I would love to try to do that, but I got to tell you, if you don't see it, it's really hard to describe it. But the studies have been done. Several years ago, I met the man who actually started this program in Washington, D.C., and he had video after video after video of experiences that he'd had putting earphones on people. And you can find it all over the internet on YouTube and everywhere else. But it brings back, music is one of those things that brings back the soul of the person. So you can take someone who is completely and totally non-responsive to their environment and put the music on them, and this person just comes from the depths, and you can see them start to interact with their music, and maybe even with you. It's just an amazing thing to do for folks. It's very detailed, the details that it entails makes it worth the time and effort spent. It's just, they come alive is basically what happens. And that's actually the name of his video, is Alive Inside. So if you ever have a chance to see that. But it has to be something that's really important to them. It can't be music from their era, for instance. It has to be something that they really enjoy. So I hope I explained that good, but they do come alive. It is basically what happens to them.
Sure, Beth has a question.
I haven't had a chance to get very far on your website. I was just looking to see if there was any kind of official announcement about that 5-star rating.
Yes, there was.
Because I'd like to share. Okay.
Yes, there was.
It's
It's
website or Facebook? Because I'd like to share
It is on Facebook, of course. I hope all of you have liked our Facebook page, because that's the way for us to get that daily stuff out. I think the Patch ran it, and it could have been. I didn't see it in there, but the other 2 awards from the Illinois Healthcare Association were in the Herald News this weekend. So yeah, but that's also, the link is on our Facebook page.
Okay, thank you very much, Becky. Okay, the next report I'll place on file is just the Board of Health approved meeting minutes from 5/17. So you have all that in your packet. We'll move on to old business, which is a little like new business every day. Dr. Burke. Thank you.
I appreciate you letting me report today, and what I'm going to do is I'm going to pass around a mini report, and I'm hoping that that's what I have on here is what you would like to hear from me every month. If not, we can make some changes, and I'll know I'll submit it in advance so that everybody has it in advance. Is it hot enough for everyone today?
Definitely hot.
Wonderful. You love the heat now. Okay, so I belong to the statewide committee that's been pulled together to address opioid overdose deaths in Illinois. And as part of that committee, we had a presentation by the state planning committee, which is all the directors of the public health departments that have something to do with opioids. They're planning the strategic plan, and our work in our advisory committee moves up to that. And so I'm hoping in the next couple of months I'll be able to present that to all of you. But in the meantime, I thought what was significant that came out of that committee meeting was the statement that we are into our third wave of the heroin epidemic. Our first wave was with prescription drugs, where we had an increase in people misusing prescription drugs, the fact that they were being overprescribed. The second wave was heroin, and that's what we've been, in Will County, been very active against trying to stop that wave. The third wave now is fentanyl, and because it's a manufactured substance, it's presenting challenges for us to be able, for the DEA and the law enforcement officers to be able to get a handle on the supply, where it's coming from, keep it out. But also it's affecting our overdose prevention program because it is stronger, 50 to 100 times stronger than heroin. So the naloxone that we use is not always effective during the first spray, so we have to use multiple sprays. So, and we anticipate that it's going to get more serious and more deaths because fentanyl, you die very quickly because of the strength, and so there's not even a chance for a first responder to get there. And so that's what we're gearing up for, is that kind. So the goal when you have something like that is to get people into treatment as quickly as possible before they're in that situation. So our opioid overdose deaths as of June 19th, this is based on our Pat O'Neill's coroner data, is 45. Now, on the website, you may see a discrepancy in my number and Pat's number, because Pat is counting heroin and fentanyl, and so you'll see the overdose deaths. I've included 4 of the deaths, which are hydrocodone and oxycodone, and they're staying, and I've talked to Pat about this, and it's an appropriate opioid death. So we've had 45 since June. That's a lot. The Narcan training, though, in response to that, has been going very well, and we've actually had 16 saves this year from the deployment of naloxone. So those are 16 lives that would have been added to the death list of the 45. Last year, overall, we had 11 saves, so we're way ahead of the curve based on the program. So I'm really pleased that the word's getting out and we're expanding that, which is the reason I'm here. So I'm glad to see that something's happening. Part of what I'm charged with is the number of community meetings that I do and the number of people who get the naloxone that I'm able to provide through my grant free of charge. And so first, before I even started this position, all of our officers in our police departments were trained. So and I'm seeing a few recently reach out to me because they're starting to get overdose deaths in their community where they didn't have any before. In February through June, February is when I started, through June, I've trained 168 people. And we've just delivered 168 boxes of Narcan to everyone. And as you recall, the Narcan box has 2 doses in it, 2 4-milliliter doses in it. So, and those items were distributed primarily in Joliet, Moni, Morris, and Wilmington. And the reason for that is because they've held meetings, or they've come and requested that I train their staff. The Wilmington in particular, we just trained another 50 people there the other night, and they continually reach out. They have a very active coalition, Wilmington Coalition, so that's been very helpful as a collaborator for getting the word out, getting information there. I trained their bartenders when they were taking their class, because they're often the people who come in close to people who are high risk. The goal for me is reaching more people who are in the trenches, so to speak. Those people who are either active users or families and bystanders of active users, people who work with folks, because that's the close, I want to get as close as we can to those folks who could potentially die. Now that we have all our first responders equipped, that's great, but they're not always the ones who are at the scene who can save a life. It's often somebody else within their community who could have their family or another person. So in response to that, we've been working, thank you, with the jail. And Judge Carla has reached out to me, and we're introducing a program to educate the judges about addiction and what naloxone is, and what does a person who's suffering from addiction look like, so that when they present in front of them, that they understand some of their behaviors. They understand the addiction is driving many of those behaviors and not necessarily the individual. So sometimes it takes years before your head is back. Your brain is working functionally the same way it used to, if at all, when you're addicted to opioids. She's also asked me to once a month come in and train talk to the folks who are in drug court, the individuals who are incarcerated in drug court, and the veterans program. So I'm really, really happy about that, because that gets the word out. People are in the community, and that alerts people who are most at risk for what can be done. Also, we're going to start an education program about medical assisted treatment and naloxone in the population, the general population of the jail, so that when it's time for them to be released, there is a new program that's been introduced by family guidance. I want to say family guidance, but I don't think that's right. But they got a grant where they're going to be giving Vivitrol to folks who have a substance issue before they are released from jail. When they are released, they go, Vivitrol is a substance that lasts 30 days, and it's a deterrent to using, it reduces the cravings for an opioid. It's a non-opioid based medical assisted treatment. And so folks would get it before they leave jail, and then they would go into treatment with the Family Guidance Center, and they would then receive 2 other doses of Vivitrol as well as counseling. So at the end of those 3 months, they also then would be enrolled in Medicaid, so they could continue their care. Because that's one of the biggest challenges, is when someone is released from prison, they don't have any health insurance, they can't get care, and even if they've been given care in the facility, they can't keep it up. And the other thing is that we know that there are many overdose deaths that occur 2 weeks after people are discharged from either prison or treatment. That's a high-risk time. That's a very vulnerable time. And so we want to have people committed to an agency that's going to watch out for them and to give them their care. And so this is a wonderful grant that we've been able to receive also through the CARES money through SAMHSA. So to date, our 16 saves, on your sheet will show you where a lot of Lockport's hot. Lockport has a lot of overdose deaths occurring. Romeoville and Joliet are next in line. So another program that we've instituted and expanded recently is the Safe Passage program that's offered through the Will County Police Departments. That's a program where you can come into the police department and ask for help to get into treatment. And through the procedures that we've set up, people can get into treatment within 24 hours. And that's the key, because when people are ready to get into treatment, they need to get there. A lot of times the barrier is they have no insurance or they have no money. And so I submitted a JAG grant, a competitive JAG grant, to provide us with resources to help people who do not have any income get into treatment immediately. Because there are programs around the country that we have relationships with that will take people for as little as $1,500 for a month of care. And so through the Man and Recovery Foundation, we've been able to establish those connections and those resources. I also asked in that grant to have a coordinator, a care coordinator, who can work with the police departments and the community agencies like the hospitals to get people into care quickly, so that we can expand this to every single police department in Will County. That's the goal. Right now we have 5 that are functioning, 2 on the list that are interested in joining, and we'll be moving that forward. The folks who've already been in, it's been working very successfully. And I believe we've gotten 8 people into treatment that would not have had any other way of getting into treatment, because nobody walks into the police department and asks for treatment if that's not their last choice. So that's part of harm reduction. That's part of my primary responsibility is harm reduction, is to reduce the number of deaths. But also the other side of my hat is through the resources that Will County provides. My salary is about the educational services. And so I had a meeting where I brought people together to find out, what are you providing in the schools? And so I'm currently creating an inventory, and so that we know who's providing it and what's what. And I'll be talking to the superintendents and Regional Office of Education about that. But what we know right now is that Robert Crown is in our community. We do have a JAG funding that we provide for them to be able to offer services for high school, the 7th, 8th, and 9th grade. Robert Crown's program is an online learning management system where it's a resource to people who want to introduce it into their curriculum. It's not a standard curriculum that you have to do this, do this, do this. It's meant to be integrated into many other subject matter in the schools. They also have a 4th through 6th grade program that is a fee-based program that people can ask for at any time. The other people who are providing services are Chestnut Health Systems. They teach Too Good for Drugs in 6th through 8th grade, and they are currently in Gompers Junior High. So they get funding, and they are only funded for that school. That's all the amount of funding that they have. The Wilmington schools are teaching Lions Quest, which is a elementary school program that's produced by the Lions Club. Which I never put together until I was reading through the materials. Lions Quest, I always wondered about that name, right? What's lion got to do with drugs? Well, because it's Lions Club, so who just had their huge party downtown. I don't know if anyone knows, it was like their big anniversary. And then the National Guard also has a program that they take into schools, that's new to me. That's very interesting. I haven't had a chance to see that program yet. But we also know that the Sheriff's Office has a school program that they go into the schools. So what we're trying to do is to align everybody so that we're not overburdening the schools, but also we're making sure that all the schools have some support system to be doing the prevention side of addiction. And so it's promising so that we have some things. And I think as we maintain access to more resources, we'll be able to spread that around. And I also think that the schools are very much aligned to getting something in that prior to this, the alarm hadn't set off as strongly, and now the alarm is going, because we're not getting better, it's getting worse. 2 collaborations that have been very important to us. One is with the Brightside Clinics. Brightside is in Orland Park, and they provide a program where if you want naloxone and you have insurance, you can fill out this form, and the form will allow you to, then you give it back to Brightside, they send it in, and you get it delivered to your house that day, or the next day, and it's like $3 for the naloxone if you have regular insurance, and if you have Medicaid, it's nothing. It doesn't cost you anything. So I'm going to send these around, so if you're interested, you can take a form and fill it out, and if you know someone who is interested or would like it, please feel free. So that's a great collaboration that we're able to supplement both the naloxone that I have, but also for those folks who can afford it, who have insurance, it helps spread the love around. And as I mentioned before, Family Guidance Centers has been a hugely resource for us, because they are working with the Will County jails and are a collaborator with me. We both sit on the statewide committee, and I've asked them in their grants to get some more naloxone. If anybody can get naloxone, let's get naloxone, because I go through it really quickly. So we want to get as much as possible. And then finally, the good news, and I'm going to call Nick up here to have explain this. Is that we did get funded. I found out was it July 1st or July 2nd? We were funded for our 2nd year. So And we were funded at a rate that any money that we did not get last year because of the short time frame rolled into this second year. So we will be receiving $173,540. And Nick would like to explain a little bit of that. But my last, I'm throwing it around, so I better tell you what it is, right? So one of the problems with people accessing opioids is that everyone has prescriptions in their medicine cabinet. Well, there are people who need opioids. And so we've been trying, the people have been trying to figure out a strategy for limiting access to it by people who shouldn't be in it. And so now they are, Mariano's, who is a partner in this fight against opioids, has now come up with a locked medicine bottle that it has, you can unlock it with the
Right.
and then this comes off, and so they're piloting it, and I happened to run into the woman and ask them where you could pilot it in Will County, and Frankfurt has a Mariano, so we're going to be piloting it in Frankfurt and see. But it's pretty cool. So it's 1, 2, 3, 4 if you want to like try but.
What's the cost of your prescription goes up? Because you have to pay for the bottle? Or is that funded by Mariano?
Right now it's just funded through Mariano's, yeah. Through their pharmacy, so yeah, no. I don't, that's a good question though. I don't think they're adding another $1 or $2 on there for the, like, you know, over the counter, like your pill counter, you know, that you have to put all your pills in and they charge you for that. It's like, yeah, that could help, but.
Yeah, it's like, it's cool, so way cool. And to me, $1 or $2 is worth a life,
Yeah.
so.
Well, it's also for us seniors who might be taking the wrong meds, right? They might get mixed up with their meds and someone else's meds, so it's really a life-saving. And it's just been in the works for a while. I've heard about it for a year or so now. It's the first time I've actually seen it manufactured. Yeah. Anyway, Nick can talk more about the grant.
Just quickly, I spoke to Reagan yesterday. We just got this award, official award, and as is often the case, the time frame doesn't always line up perfectly with county board meetings. And in the past, and we can always change the process, but if there's a time element, we sign the grant, we come back to the board after the fact and ratify it, or have a kind of post, whatever, after the fact. This works out that we could at least appear at the committee, but we would like to sign this, we need to sign this in these 30 days. So whether it can be done this month still, or whether we just push it off to next month and do it at next month's meeting, I would hope we could just do it this month, whether it be through public health, executive, or however the board wants to do it. But this is good progress. This is a 5-year grant. We passed the original resolution. It was 1749, was in February, and we kind of got that on short notice too. But that resolution actually accepted the grant and allowed us to hire Dr. Burke. This year we'll just be accepting the money again, and it gives us a chance to promote what we're doing, give an update to the public, I think, which is important. So we're all in favor of doing another resolution, if nothing else, to promote the continued effort, because their need is still very great. So whatever works for them.
I think you guys should recommend that it go to executive next.
Well, I think they could save space, could they not?
Yeah, I think we'll definitely save space.
Yeah.
We can recommend a resolution at our level, and we can go ahead and put that motion forward, right? Do I have a motion for that? Motion by Dollinger, second by Don. All in favor?
Aye.
So everyone does agree that it's a great thing, and I'm glad we're going forward. I think that so many people don't. If it doesn't impact you, it's kind of like, like when you're a farmer and you're in eastern Will County and it's raining nice, you don't care about the farms on the west side of town because they're not getting the rain. But eventually it happens to you or somebody you know. And so I know from feedback we got from that opioid thing we had out in Beecher as community conversation, which was really good. But I know that I spoke with some people who didn't come just because it was an opioid thing. That, wow, I don't have an opioid issue. But the point is, you never know when somebody might go that next step, or somebody you know. So it's something that people need to think about. If it's happening somewhere, it's happening to somebody knows and cares about deeply. So I'm really glad we keep promoting this.
If I could just give one other just kind of update. Some of you have heard this before, but when we were in Washington recently, speaker moves to Suzanne Hart and myself, one of our stops was at HHS with SAMHSA, I guess it was. And so we met with staff there. They were very interested in what we were doing. As a result of that visit, we're actually have a call scheduled later this month with the Region 5, I think is the regional director for this area, and her staff. And this is a way to loop Dr. Burke in with them, but also they were very interested, not so much because we're doing so many things. We were rattling off all the things and they were making suggestions, and I was telling them we're doing that, we're doing that. So they're interested in what we're seeing as a result and getting feedback as much from us as they are going to give us more information. But this does give us opportunities to pursue at the top levels of the region and at the feds for additional funding opportunities. So we can report back on that in future months, but we do have a call later this month, and that's where those trips are valuable, when we can make those connections and sometimes get a little bit extra information on grant opportunities and things like that, and also to promote, unfortunately we have to do it, we need to do it, but what Will County is doing, and that can be a model for a lot of other areas of the country where they're just starting to feel the effects of this, but they're learning from our lessons learned, I guess. So, and then the last thing is, we're, along with all the other things Kathleen's doing, we're continuing to do additional outreach. We're going to start working with some of the hospitals, because one of the things I've heard from people who've had overdose deaths and things is there's still a lack of information about when you go into the emergency room, kind of what happens, how they handle patients who are overdosing. There's also lots of questions with the legality. The Safe Passage program is a good step in that direction, but parents say, what happens when my kid overdoses? Are they going to lock them up? And that attitudes have definitely changed over the last 10 years, but so we're going to continue to work on new ways to educate folks, and I know we're going to schedule some more forums around the county, but it's, unfortunately, the deaths were dropping for a while, but they're coming back up, and there's still a lot of work to be done. So we're going to keep working, but we'll keep reporting back to this committee or whoever we need to report to. So
I think it's really good. I think that this information you gave us is great. You know, I'm hoping that, since we do have Grant Spooner here today and he records our meetings, that's great. And I'm hoping that, you know, just by somebody watching it, they're able to help somebody in their own family, or perhaps a neighbor or somebody, you know, when you're talking with your girlfriend or the guys who are at the, you know, hanging out,
Right.
golfing or whatever they're doing, that they can go ahead and say, hey, you know, we were watching this the other night. And so minimally, they know they can contact Will County. They can contact Will County, and then we'd be able to push, you know, give them the information they need to go get the services and help that they need.
Right.
So they know that Will County is doing everything that we can to go ahead and help. Somebody want to comment? Go ahead, Beth.
For the training of the judges, the program, was that an existing program, or was that something that just Will County, you know, put together at the request of the Will County judge?
That's something I'm putting together. I haven't done it yet. I have a colleague who's done it, who is from Rush University, who's done it, the judicial system, so I'm stealing some of her stuff. But
I just wanted to say, I think it's outstanding. You know, it seems like, I'm sure the judges with all they do will appreciate it so much, and just you coming here, I've got such a better understanding.
oh, thank you.
I'm sure they appreciate it, and I was just curious if it was an existing thing. I thought I'd take a look at it.
No.
Okay, thank you very much.
I think Task has one that they use, but again, it's about having it available to people. So, and I know this county, so I've watched and observed drug court and the clients and the situations, and so I want to make it relevant to specific judges in our county. So that's what's important to me. Thank you.
So my question is, with working with the hospitals,
Lori, could you push your button so they can hear stuff? She's quiet.
with going into the hospitals in Will County, are you going to be educating staff as well? As much as I want to say that my profession rocks, which it does, there's still a lot of medical people who are not just also very judgmental. Are you going to be working with the staff as well?
Well, first conversation is with the hospital. What do they need and what's going on? What are they doing already? Because there are some hospitals that are being very proactive and there are some that are not. And so the idea is to reduce the stigma and have them educated as to what addiction is and how it needs to be treated, because that's what's not going on in the emergency rooms. And so, yes, it'll be, again, it's a collaboration with the hospitals to identify their most critical needs in order to get our patients taken care of better.
So then I'm just going to push this a little bit farther. When they do this education, and you are going to be going to probably administration first, which is usually the first step.
Mm-hmm.
Will you be doing the presentation with staff?
Actually, it depends. Sometimes it's more effective to have, like I know with physicians, it's more effective to have a physician teach other physicians. And with nursing, I would probably say the same thing. Do you have a recommendation?
I have a recommendation, of course. When doing the presentation, my suggestion to you is that you stand right alongside them and provide the information as well. Because as me being a nurse, I learned as much as I knew about this. I have learned rapidly so much from you. And I think besides it coming from one of their peers, it would be really good to have, okay, this is what I do. This is my gig, and you know, not saying that, so this is what we're doing, how we're moving forward, and this is what we need to identify. Same with the nurses. Yes, you should have a nurse standing there with you, but we need to stop that because truthfully, they're the first line of defense going into the emergency room.
Right.
So.
I think that's a really good point, and my goal is to be a resource and to help them understand, and I'm on the ground floor, I'm in the bushes, so I can bring that a different perspective before the patient even gets to the emergency room what's going on, because most people don't understand that.
Okay, great. Nick and Dr. Burke, I just want to thank you for bringing all the information forward. We look forward to hearing things, and I hope that we can continue to see our saves going up. I know our sheriff's department works really hard and all the other police departments, so I think that's really good, and I think this is good. What I'd ask my committee to do, if there's anything else after you review the report further, when you're at home, if there's any other thing you think you might want to ask, go ahead, send it in to Karen, and then Dr. Burke can go ahead and add it. So, all right, thank you very much.
Judy, could I ask Dr. Burke a question before you go?
Yep.
I came in during your report, and I heard you say you're working on a grant to help those that's incarcerated before they're discharged with the drug. What was it, 30 days?
Vivitrol is the drug that lasts 30 days,
Right.
yes.
When they're discharged, is there a caseworker, a social worker, someone that's going to follow up with those?
That's the program.
The grant will cover that as well?
Yes, they get referred to Family Guidance Center.
Oh, I see, and they will track. Okay,
Yes,
okay.
yes, absolutely, because it doesn't do any good.
Correct,
Just-
correct.
right.
Okay, thank you.
We're on the same page.
Okay.
Okay, great. All right, thank you very much. Okay, we're going to move on to other old business. Any other old business? Tom?
Last month I brought forward the proposed ordinance on leaf burning, or burning ordinance change. I didn't see it on your agenda here. I think last month you indicated you were going to do an in-depth study on it, and I wondered if, what you've got planned in that regard.
Okay, so what I would like you to do next month, Tom, is for you to come forward and just let us know what you've done in that area yourself, because I'd like to know what you've started on, what you've done, what type of outreach you've done. I'd like to hear that information. And then the next step, Mark Ferry is going to be working with me, and we will be putting together a process. But it'd be great to know what you've already done and where we might move from there. I don't know that the board is, this committee is very interested in doing a lot of ordinance changes from having spoken with people. But let's see what you've done. So if you could put together a little list of the things that you've done in your community where a lot of the issues come from. And besides the letters to the editor and people writing in comments and emails to us, because we're never going to find, if we're talking about a subject, which is great that the community is listening and they're hearing us and they are writing letters to the editor or sending in letters to us, I'd like to know what you've done in the district to go ahead and do that. So if you could plan for that for next month, I'd like to know what you've done. If you've had 3 meetings or whatever you've done, I'd like to know that. And then Mark Ferry and I are going to go ahead and move forward on looking into what you haven't done and stuff like that.
Mr. Sheriff Concho has prepared a model ordinance and gave it to Reagan, I believe.
Right.
Your committee might want to review that.
Right. Right, and we will be reviewing that. It just isn't on the agenda for this month because this agenda was packed. As you can see, it's 9:45 right now. So I'm asking, go ahead. For next month, Tom, I'd like you to present us that.
Also, I believe state's attorney had looked into the township or authority as far as burning. Did you have a comment about that?
Well, we had.
Could you come up, Mary, please?
We did previously issue an opinion with regard to, and the question had been the authority of townships and fire protection districts to pass their own regulations with regard to burning. And previously, we did issue an opinion indicating that townships do not have the authority to regulate burning, and fire protection districts only to the extent that if there is some sort of an emergency such as a drought where fire would be hazardous, they could order no fires for a short temporary period of time, but they cannot generally regulate.
Okay. I did read in the Chicago Tribune this morning that 10% of the children statewide suffer from asthma. And so I think it is a significant amount of people that are involved with smoke in their neighborhoods. So I think we need to continue an in-depth study. I did get an additional email since our last meeting supporting a change in the ordinance. So
Okay,
look forward to working with you on this.
Okay, so that's great. So next month, come prepared. Tell us what you've done so far in your community where there are a lot of these complaints. Let us know whether you've held meetings, we've gone door to door, what kind of campaign have you put together to try and work on resolving it within the community so that we can have that information, and then Mark Ferry and I will take that and we will move forward with it. So thank you very much. Okay, we're going to move on to other new business. First is Rita. Is she out there somewhere? Oh, it's Kevin. This is okay, this is a awarding bid for diabetic supplies for Sunny Hill Nursing Home. Go ahead, Kevin.
Good morning, everyone. Good morning. This bid is basically the same as the 2014 bid with quantities updated.
Oh, could you please push your button? So, thank you.
Quantities updated due to population needs. We released this
Can you
bid.
pull it down too? Thank you.
This bid was released on May 19th, 2017. We released this to 30 potential bidders, as well as the Demand Star website and the Herald News. We received 6 returns on this. One was a no bid. Out of the 5 bids that we did receive, the recommendation from Sunny Hill Administrator Becky Halverson was to go with the low bidder, Medline Industries. Approximate price for the first year is $8,112. Medline did list a 2% increase on their bid form for years 2 and 3. If we do go with the optional second and third years, the grand total for all 3 years would be $24,825.96.
Okay. We have to approve this, right? Yeah, I'm sorry, it's spaced out. So can I have a motion? Moved by Summers, second by Militello. All in favor? Aye. Any questions? Anybody? No?
Yeah, can I ask you a question? Are any of these bidders in Will County?
Yes, there was one, professional medical supply.
Okay. All right, thank you, Kevin.
Thank you.
Next, we have the screening assessment and support services for child and adolescent behavioral health, Michelle Zambrano, Sue Olenek from Health County. What is it?
Will County Health
Will County Health Department. I don't know what happened to me. I think I got lost somewhere.
Good morning, everyone. Good morning. I'd like to introduce my staff.
This is Michelle Zambrano. Michelle is a master's prepared counselor. She's also a licensed clinical professional counselor. She's been with our agency since 1990. And Michelle manages both the SAS program, which you'll hear about this morning, and the Child and Adolescent program, which is a distinctly different program. To her left is Dr. Rita Gray. Rita holds a PhD. She's a licensed clinical psychologist. She's also a nurse, an RN, and she's also just completed her education to become an APN prescriber. She hasn't taken the test yet, but that will happen in January, and we're very, very lucky to have both of them. Rita is backup for Michelle on the SAS program and Child and Adolescent. She also manages our nurses in behavioral health, and she also runs the APA program. And anything else?
No.
That's all?
I have a list, but.
All right, we just want to, we did a little fact sheet for you, just in case you guys might not know. SAS stands for Screening and Support Services. And what it is it's been around and we've had the program for about 10 years. And what it is that when it's been determined in all of Will County, eastern, northern, southern part of Will County, that it's determined by the schools, home, hospitals that a child potentially needs to be hospitalized. What they do is they call the CARES line, and the CARES line then connects with the SAS program, who does the screenings wherever the child might happen to be. All right. With that is we have staff trained to do assessments to determine whether the child needs to be hospitalized or not. If they're hospitalized, then our staff makes all the arrangements for the person to be hospitalized. If not, then what we do is our staff program then follows the child for 90 days, linking them to either therapy, to psychiatric medications, and then after the 90 days are up, whether the SAS team then determines whether they need to go into our Child and Adolescent program or into another community-based program. Any questions? All right. Basically, what our SAS program service is, or who we serve, I'm sorry, is anywhere from 2-year-olds. Our youngest has been 2, and we can keep them or screen them all the way up into the day before their 21st birthday. We screen for, and we treat any kind of diagnosis. We cannot rule anything out. We cannot say no, that's not what we do, or what we can't do that. We have to go wherever the crisis is. We have to serve whatever the crisis problem presents. And the SAS program has screened quite a bit of people in the community. Some of them have been pretty severe. We've had kids that we've gotten calls from the CARES line stating that a kid has posted up on social media to not go to school. I'm bringing some guns. This is it. It's over. So what we've been able to do is through social media, some of the kids have called and called the school, called the parents, called the police, called the hospital, called whoever, and they got them screened, and we got them treated, and we got them hospitalized. We've had kids who are suicidal in school, suicidal at home. They've presented with issues such as harm to animals. They've presented with harm to other staff members, or staff members' classmates, school staff. We have a really wide range of kids that we have serviced throughout the Will County community. Yes?
So when you say a child presents, are you going into the home?
We go to the home.
You're reaching out to them.
Right. The CARES line calls us and tells us where the kid happens to be. If the kid is in school, we go to the school. We've actually had a kid who presented at Panera Bread over on 59. So we're in the parking lot, in the car, doing an assessment to determine whether this kid needs to be hospitalized. And so we go to wherever the crisis happens to be.
So at that time, if he does need, say, to go to a hospital, do you call 911?
No, what we do is we have a list, all of our staff have a binder that has all the different hospitals and what, so to speak, is what their specialty is. Then we just call the intake and tell them this is what we have, this is what's going to go on. Then we call what is called First Transit, that's the one that we use, and they transport the child from, it's an ambulance service, they transport the child from their home to whatever hospital.
Unfortunately, they're usually aren't any beds in Will County
Right, no.
that we can use.
Right.
So we have to have a transport system that can get them to the beds in these other areas.
Right.
This is a 24/7. We have staff that are on call 24/7 for this. We have staff that do this during the day as part of their regular day, and then we have some staff that work in child and adolescent and work with children, counseling children during the day as a clinician, but then do this at night. And they receive a specific payment for the screenings. But this is a constant thing. Michelle and or Rita have the phone like glued to their ear all the time, making sure that the kids have the necessary services and the parents and schools, whatever, have the services that we need to provide. I just want to say something. When you guys are going to speak, please make sure that you're pushing your button on so that you're the star of that conversation. Thank you.
So, did you have a question?
Is there a 21 and over program similar to this, or does this kind of program stop at 21?
For the most part, it does stop at 21, and then we just we don't leave anybody. We try to then do a referral to an adequate program, and so that may be initially with the crisis, the referral to the emergency room.
We do have, it's called ACS, and it's, it's similar to that. Basically, we don't go to their homes, is that they present at the emergency room. But then we would try to get them the care, get them linked up with mental health services, if they need to be hospitalized, trying to make that arrangement. So it's not exactly like SAS, because with SAS we go to their house and wherever, but if they're presenting at the local hospitals, which is right now is just the two of them, that's where, we perform that service.
How do you get the word out about this?
Hang on a second.
Now you're on. I thought I was on. Okay, how do you get the word out about this to the schools? That's what I was wondering, because I think I think it's nice that, I think the schools should know about this.
Oh, trust me, all of the schools know about this.
They know.
We do, the staff, they do presentations to all of the local schools. We meet with district supervisors, with the school superintendents. We meet with school social workers. Anytime any of them want us to come and present, we do. We get school, like when it's kind of slow for summer, but usually when school starts up, we're rocking and rolling. If you looked over here, it's since January of 2017, we've screened 941 people. Okay, that's not counting like other counties screening them and bringing them in that we service. Those are just us eyeballing them and determining what we're going to do. And then counting the county fiscal year, counting December, as of December 1st, we have 1,098.
I also spoke at the Regional Office of Education, their end of the summer meeting, and this was one of the programs that I highlighted shortly, but I highlighted. So the information is out there, and the resource officers at the school know it, schools know it. It's out there. If they need it, they know where to go.
And most of the schools, like in the community, already have, we've designated 2 people as hospital liaison people and school liaisons. And what they do is, a lot of times if the schools are like, I don't know if this is someone that needs to be screened or not, they'll call and ask my 2 staff members, what do you think? Does this sound like something that you guys should come in and do? So all of them have our phone numbers. It's everywhere.
Yes, it is. I've been at the schools and it's posted. You can see it at certain persons' desks and posted around the school. In addition to that, when someone calls the health department, it's on the greeting menu, and the number is given right there. We give it at the front desk. So many of the parents have it, we hand it out to them. So they do have that information. I just wanted to add to this that it seems like this morning we're talking about crisis programs like with the Narcan, and the end goal for both of them is preservation of life. And not only that, we don't just dump them after the crisis, it's helping them return to more effective ways of functioning. I have a passion about this program. I helped to start it up 10 years ago. And so I just see that it's vital and it's critical to the community. What the University of Chicago is doing a study for the Department of Human Services looking at outcome data from from the SAS program. I just know from the testimonials from parents in the schools and the staff at the health department that this program has for sure helped to avert some suicides, probably several of them. It's decreased hospitalizations because when we do the screening, you know, not everybody needs to be slammed in the hospital. They can get more intense services in the community. We call that, you know, the screener, if it's done early in the day, call that same day, check in with the parent, give the parent, they walk around with cell phones, so they're constantly doing outreach. They see the kid, you know, 2 to 3 times a week with intense individual and family counseling. So it's, you know, not a program that just ends like that. But in addition to decreasing hospitalization, suicides from the school and the parents and the kids themselves, they give testimonials saying it's increased grade point average. Some kids that weren't going to school because they got intervention, now they're kind of getting more on the straight and narrow. It's also, we have probation is in the 2 Joliet high schools, and testimonials from them have said that it's increased probation involvement with kids that are legally involved. And it's just really, I think that the benefits of it far outweigh any costs. And I know that the program generates a decent amount of income for the health department. So the other thing is, I just think about the kids, and I'm thinking if it wasn't for this, they'd either be in jail or in the detention center, they'd be in the emergency room. You know, the parents would show up there repeatedly without the guidance of this program. And then, you know, other things, they just, they would be, God forbid, you know, a completed suicide without our intervention. So it's not just vital, I think it's critical, so.
And one thing I wanted to make clear is the 90 days that we follow them wherever they prefer. So with, unlike other counseling programs, is with our SAS, they might have to go to the house if the parents prefer that they would like to have the therapy in the house, or at the school. So they go to wherever the child is and wherever the child needs the services. If the parents and the child deem that we need you to have counseling at the school, that's where the situation is to help them. That's where we go. No questions asked.
Dr. Burke, you want to
I just wanted to point out that the services that they're providing is actually prevention for substance use, and I can't stress enough that this is what kids need in schools. The education is one thing, but the support services for mental illness is the most critical factor, and for ACE, for serious activity, adverse childhood experiences. So this is a strength that Will County has that many communities don't have, and I'm really pleased that they are so active in the schools. So, and I'm really looking forward to working with you as far as this goes.
So the program, we not only need to retain it, we need to grow it, enhance it, improve it, expand it. It's really been, and I think it's also some kids that were repeatedly in the hospital, once they can reconnect with SAS services, they don't need to do that. You know, it can be a traumatic experience for some of these kids to be in the hospital. Don't get me wrong, some of them want to be in the hospital, but for others, you know, it can really kind of set them back a little bit.
So my question is, not only to you, but is to Catherine as well. I would appreciate that all these updates you just gave me, if you can send them to my county email, because this is getting posted repeatedly out in my area of the county. Because it, you know, I'm not sure that a lot of people are even aware, especially since it's not talked about a lot. So I'm going to be out there being the voice for you guys, and I'm so happy that you guys are here. So thank you.
Thank you.
And that is the reason why I've asked Sue to go ahead and bring forward the programs, and I've asked Dr. Burke to bring forward those programs so that we make this well known everywhere. Because a lot of times you're a parent and you really don't know what to do, or even if you're a kid and your friend has trouble or you have trouble, you're not sure where to go. And it's really to help us eliminate the stigma of, you know, everyone has problems from time to time. We all go through stages in life that some moments I'm really in a bad situation myself, and then it just needs somebody there for you. Sometimes it's just a friend that can help, but sometimes you really need additional support. So that's why I've asked the different departments to come forward every month so that we can learn what the health department is providing, what services they provide, and how they're applied, and what the need is. And then we learn that it is in the schools and it's posted and that the schools are well aware of it. And Dr. Burke, I mean, like the opioid thing, people think it's not going to happen to me. Well, you know what? It happens to you somehow, some way. And so I think that's why it's important to go ahead and bring issues that the county is. We're fortunate to be in Will County. You know, other counties don't have some of the services we have. So we're fortunate that we do that. We're fortunate that Sue looks at her budget very closely and says, you know, I really, really need to keep this program, or this program is now handled this way, and I appreciate that. So that's something we need to look at. So the dollars that are available to us can be spent where we absolutely must spend them, so.
And you can see the caseload that they deal with, just on any given day, it's like 64, 65 kids on any given day. We're not talking about a handful of kids, we're talking about a really healthy, unhealthy amount of kids that are in crisis.
Right.
Thank you.
Okay, well, thank you very much, ladies, for the update. Appreciate that. Okay, let me get back to the agenda. Okay, next thing is other new business. If anyone has anything else? No other business. Do we have any public comment today? No public comment. I do not have a report or announcement. We do not have executive sessions. I'd like a motion to adjourn. Moved by Summers, second by Gould. All in favor? Aye.